Hi everyone, so today we are doing glaucoma. Glaucoma is a group of eye disorder that is characterized by optic nerve damage and visual field loss, usually associated with elevated intraocular pressure. So very important. Intraocular pressure gets elevated because of which glaucoma results, and then there are high chances that the person can get completely blind. So there are different causes of glaucoma. One is primary and the other is secondary. Secondary results from various diseases and various other conditions, right? And primary is because of direct effect on the drainage mechanism of intraocular of the aqueous humor. So basically, intraocular pressure is maintained by aqueous humor, right? That's one thing we know. So if there's any disturbance in the production and drainage of aqueous humor, that's when glaucoma happens. So either there'll be increased secretion of aqueous humor and decreased excretion or removal of aqueous humor. That's when glaucoma happens because the intraocular pressure starts increasing so much so that the pressure on the eyeball increases. And when the pressure on eyeball increases, what happens is that the optic nerve here, it starts getting compressed. So when optic nerve is compressed, then obviously the person cannot see clearly. And also the other thing that there is retinal artery here, which is the blood supply for your eye, and that also gets compressed, because of which the entire optic nerve doesn't get the sufficient nutrition that it needs to the retinal artery because it is compressed, and there's further necrosis and the person cannot see. Anyways, coming back, under primary glaucoma, you have two types. One is open angle glaucoma, and the other is closed angle uh, primary angle closure glaucoma, right? So in the open angle glaucoma, there's basically obstruction that blocks, the trabecular meshwork. That could be either because of the lymphocytes or the red bloods because of some infection or hemorrhage. So infection results in excessive lymphocytes and white blood cells, and because of hemorrhage, there'll be excessive red blood cells that will be blocking the trabecular meshwork. That is open angle glaucoma. And in close angle glaucoma, there is narrowing of the interior chamber angle. Basically, the iridocorneal angle, which is the angle between the iris and the cornea. Iris and cornea. Where is iris? This is the iris. This is the cornea. So when there is closure of this angle or it's narrowing, that is what we refer to as closed angle glaucoma. But in open angle glaucoma, there's some obstruction. Something is, it's here and it's blocking the pathway. And what's the production of aqueous humor? The aqueous humor, it's produced by the ciliary body. Very important here, and it drains into the posterior chamber. This is the interior section of eye, posterior section of the eye. Posterior section has the vitreous humor. Anterior section is divided into the anterior chamber and posterior chamber. Posterior chamber is between the iris and the lens. Anterior chamber is between the iris and the cornea. So, where is the aqueous humor produced or it's secreted after the production? It's secreted in the posterior chamber. From the posterior chamber, it has to flow and come into the anterior chamber. Here you have the trabecular meshwork, and then it will ultimately uh, drain into the canal of Schlemm. So, from trabecular meshwork, then canal of Schnell. Canal of Schlemm is basically what? It is your vein only. It's a vein only, but because it is completely, it's not, it doesn't have blood at all because it is completely filled with the draining aqueous humor, right? And then this further drains into our eye aqueous veins, and then the blood veins, and then it goes into the systemic circulation. So close angle glaucoma, iridocorneal angle actually closes, and here in open angle glaucoma there is obstruction. So open angle obstruction, close angle, the iridocorneal angle right here you can see it obstructs. So let's read this. Gradual obstruction of trabecular meshwork because of debris, that's open angle glaucoma. Anatomical narrowing of anterior chamber angle, that is angle closure glaucoma. Secondary reasons could be because of protein deposits, it could be because of some other disease, diabetes or hypertension, it could be because of some injury, trauma, because of some drugs, right? It could be because of inflammation. There could be several reasons for it. Now, clinical features for open angle glaucoma usually asymptomatic early on, gradual peripheral loss, and there is very important tunnel vision. So I should have mentioned this first, that in glaucoma there is very common to have a tunnel-like vision. So this is the vision that people with glaucoma see, which is so sad. Central vision affected late. It's often bilateral in both the eyes, mildly elevated intraocular pressure. So right now we're referring to open angle glaucoma. And there are these uh, symptoms. Moving forward, if you talk about Cupping may develop if chronic. So cupping is basically the pressing of optic nerve. And then here is open angle and angle closure. Trabecular meshwork resistance increases equals outflow is slow down. And iris obstructs angle and sudden increase in intraocular pressure. So yes, this is about it.